Questions linger throughout the Red River Valley tonight as the Johnson & Johnson COVID-19 vaccine is one step closer to being administered in the United States. The company filed for emergency authorization for its single-use vaccine and is hoping to have thousands of vaccines shipped by March 1st. Valley News Team's Bailey Hurley brought your top 3 questions about the new vaccine to local health experts today, and she has the answers.
With around 66 to 72% efficacy, many of you are leery about the new Johnson & Johnson vaccine. But local health experts say there's no reason not to be excited about it.
So even though you still get the disease or may get the disease, you're not going to get sick enough to where it'll require hospitalization or a death.
Dr. Vetter says in that aspect, the new vaccine is similar to why we get the flu shot, but points out influenza vaccines are only about 40 to 60% effective, depending on that year's strain.
There is significant value in having a vaccine that keeps people out of the hospital and that, prevents people from dying.
Many of you have also asked if you already have natural antibodies in your system. Is this new vaccine better for those who've already had COVID? Pointing out that way we can save the highly effective doses like Pfizer for those who've not been infected.
Logically, it makes sense, right? The problem is we don't have data, to suggest that that's the right approach.
The what ifs are part of vaccine science, but in the short term, when these vaccines are just getting emergency use and when we've studied them well enough to know that they are safe and they're effective, we just don't have all of the answers.
And while health experts say you can't choose which vaccine you do or do not get right now, Dr. Vetter says that will likely change in the future.
Once vaccine is more plentiful, then I think certainly we would want patients to have a voice and a choice as to what they want.
In Fargo, Bailey Hurley, Valley News Live.
Meanwhile, a new research study by Bloomberg states that if vaccination rates stay where they are today, it will take 7 years for the United States to return to normal. And while that sounds concerning, both Vetter and Hall say not so fast.
Population quicker and vaccinate more people.
From my thinking and usual epidemiological thinking, that we will be in a much better spot at the end of